Save Medicaid, that is the rallying call across the country this week. Community organizers are staging rallies after Elon Musk's Doge agency began looking into Medicaid's finances. One of them took place in San Jose today, inspired by a Bay Area family's Medi-Cal challenges. NBC Bay Area's Robert Honda joins us from the South Bay.
Hospitals and healthcare providers are watching with a great deal of apprehension over what might happen to Medicaid and to see if public pressure can help stop or mitigate any budget cuts. The Save Medicaid rally at the Santa Clara County Government Center in San Jose brought out many of the South Bay's largest nonprofits, service agencies, and local leaders. The event was started by a prominent public relations agency, PRxDigital, which represents many of the groups, but got started when a PRx executive told coworkers about her daughter who depends on Medicaid.
Tessa is now brain damaged and is now living in a group home in Milpitas, and Medicaid pays for about 10 of her programs to keep her safe.
Her message was to the public and the nonprofits.
2 months ago, I asked them if they wanted to speak up, and everyone 2 months ago was like, oh God, we don't want to be a target. But now was the perfect time. They can't be quiet anymore.
Much attention was on congressional representatives Zoe Lofgren and Sam Liccardo, who vowed to take the fight over Medicaid to D.C.
President Trump has taken a wrecking ball to our government, to science, to health care, to due process. But that doesn't mean that we cannot push back.
Donald Trump fired 17 inspector generals the week he got into office. They can't find waste, fraud, or abuse with 19-year-old Doge employees.
Some speakers talked about cuts going so far as to close hospitals. The head of the Santa Clara Valley healthcare system, which wasn't part of the rally, said it's too early to tell how severe consequences could be, but emphasized that locally, many programs would suffer, especially in terms of early diagnosis and timely treatment.
Psychiatric care, inpatient, outpatient behavioral health services. You're talking about cuts to oncology services, cancer care. You're talking about impacts to trauma care.
The budget won't become final for several months. It'll be in September that we're going to be fighting it out. So we have time to organize, to engage people throughout the country.
Liccardo and other leaders will get a big test as they take their Save Medicaid campaign to the Central Valley next, a place where local leaders generally support President Trump, but where a large percentage of residents depend on Medicaid. In San Jose, Robert Honda, NBC Bay Area News.